Good evening, everyone out in webinar land. My name is Dr. Irving Robinson, and I have the esteemed pleasure of being the moderator for this evening's webinar. I want to thank the Mayo Clinic Community Outreach Program for partnering with Omega Psi Phi Fraternity Incorporated in presenting this educational opportunity for all of you who are listening in. I'm a member of the Omicron chapter, Daytona Beach, Florida. I'm on the Health Initiatives Committee, and we thought this was a great opportunity to provide some health information about prostate cancer, a very serious disease in the African American community among African American men. It's the number one cancer amongst our population. It's the second most important killer of men in our population. So we thought it would be great to kick off this series of interesting webinars with prostate cancer. So right now I'd like to turn over the program to Mr. Chad Workman, who can fill us in on the agenda flow for tonight's program.
All right. Thank you, Dr. Robinson, and greetings, everyone there in webinar land. And like Dr. Robinson said, welcome to this evening's event. First, I would like to say thank you to the Omega Psi Phi Fraternity Incorporated for partnering with us in presenting this material tonight. And this partnership, this would not have been in our midst if I'd be remiss if I did not mention how this partnership started. And this partnership started with your own brotherhood chapter of Psi Mu Nu, and ever since we've partnered with them, they've always been so welcoming and gracious to Mayo Clinic and bringing us in on what they're doing. And I'm happy to see the growth in this partnership with the Brotherhood overall. So I'd like to say thank you in general to the entire Brotherhood. So thank you. My name is Chad Workman. I am the Community Relations Coordinator here at Mayo Clinic, Florida. I am the lead for men's health initiatives here as well. And the Mayo Clinic Cancer Center is what we're housed under. And these cancer conversations are designed to bring physicians, researchers, and the community together to share and learn about various types of cancer, in this case, prostate cancer for this series, the signs, symptoms, treatments, and the resources that are available, and also the benefits of participating in clinical trials. And this event will hear directly from survivors and thrivers as well, with their stories throughout the series. So tonight you'll hear from two gentlemen, and then following the next few episodes, you will also hear from some more gentlemen. But these conversations are designed to educate us on knowing our health risk and stay up to date on current screenings. And it empowers us to change our health. And I hope that you take this information that you learn here tonight and throughout the series, and share it with your circles, and encourage open discussion about cancer overall, but in this case, prostate cancer. So at this moment, we'll take a look at our agenda, what we'll be running through tonight. And then also, we will be doing our pre-survey. So this pre-survey, here's the link here on your screen. I'm sorry, the QR code on your screen, and the link in the chat. If you could please scan this code or click the link, and this is going to gauge your level of knowledge before we get into today's discussion. And this is just this is no type of exam that you can fail or anything like that. We just want to gauge your knowledge. So we'll just take a couple minutes for you to complete this survey, and thank you for doing that. So we'll just pause for just a couple minutes. All right. So as we get the last few completions of that survey, I'll just go over a couple housekeeping tips. So everyone, except for the speakers at the moment, you'll see the speakers as they are speaking. And if you have any questions that pop up during the presentation, you can either write them down, and we'll have a question and answer moment at the end of the presentation, or you can also put them in the chat in the Q&A pane at the bottom of your screen. And we invite you to share this webinar link for others to join as time allows. And like I said, we did the survey, the pre-survey. So now we will get started and move forward with our first speaker for this evening. All right, so we have our speaker. Oh, go ahead, Dr. Robinson. You need to say something?
I was going to introduce the speaker, but we can go.
Okay.
For everyone,
yeah, go ahead.
For everyone, Dr. LaTonya T. Hudson is our speaker for the evening. Dr. Hudson is a nurse education specialist in the Department of Nursing at Mayo Clinic, Jacksonville, Florida. In this role, she supports professional nursing development and clinical education initiatives that promote evidence-based practice and high-quality patient care. Dr. Hudson's professional interests include adult education for health, disease prevention, health promotion, and the delivery of clear, accessible health information to diverse audiences. She is committed to supporting lifelong learning for both healthcare professionals and community members. So through participation in community education events like this is, church-based programs and sessions for older adults, Dr. Hudson is dedicated to advancing health awareness and fostering informative decision-making in culturally responsive and inclusive learning environments. Dr. LaTonya Hudson, the floor is yours.
Thank you so much. Good evening, everyone. Can everybody hear me pretty well? Wonderful. Thank you for being here today, and thank you for taking the time to focus on your health and the health of the people that you love. My name is Dr. LaTonya Hudson, and I am a nursing education specialist with Mayo Clinic. Today, we're continuing our Cancer Conversations community education series. We're doing the series this year for 2026 like we have done before, but we're going to be talking about prostate cancer, specifically what causes it and what increases risk. This presentation is meant to share information, not give medical advice. Everyone's health situation is different. So I always encourage conversations with your personal healthcare provider. I welcome questions, and more specifically, we will be having a Q&A session. So when that starts to take place, I encourage you to ask your questions, maybe put them in the chat, and I will do my very best to answer them in a timely manner. Okay? Next slide. So let's talk about prostate cancer. Why does this topic matter so much? This topic matters because prostate cancer is common. As a matter of fact, according to the CDC, it is one of the most frequently diagnosed cancers among men in the United States, especially as men get older. Many people are surprised to learn that early prostate cancer often has no symptoms at all. Because symptoms aren't always present, understanding risk factors becomes very, very important. Knowing your risk factors or knowing your risks helps you to know when to start conversations about screening, not out of fear, but out of awareness. The good news is that many prostate cancers grow slowly, and when found early, outcomes are often very good. The survival rate is about 98%. Outcomes are often very good, and knowledge is what helps us replace fear with confidence. Next slide. Okay, so let's start with a quick refresher here. What is the prostate? The prostate is a small gland found right below the bladder and surrounds the tube that carries urine out of the body. Its main job is to make fluid that helps support and protect sperm. As men age, it's normal for the prostate to grow or enlarge. And that growth alone does not mean cancer. Many men experience prostate changes as they age, and most of those changes are not even cancer related. Next slide. Okay, so you may hear some terms, and I want to start, integrating those terms so that you will know what they mean. This is very foundational, and this information is just for you to be armed with, like I say, general information to help start those healthy conversations. So you may hear healthcare providers use the word etiology. And etiology simply means what causes a disease. When it comes to prostate cancer, there is no single cause. There is no single etiology. It doesn't come from one behavior, one food, or one decision. Instead, prostate cancer usually develops, like I said, slowly over time from a combination of things like aging, genetics, hormones, and environmental influences. So understanding this helps to remove blame and shame when you're having these conversations. Next slide. Okay, so how does prostate cancer develop? And we're going to give this like a simple explanation or a simple view. So here's a simple way to think about how cancer develops. Our cells carry DNA, which works like an instructional manual. Over time, small typos or changes can happen in that manual. Most of the time, those typos really don't matter. But occasionally, changes pile up in a way that allows cells to grow faster than they should. That's how cancer can begin. Not suddenly, but gradually over many years. Next slide. We want to look at risk factors. What do risk factors mean? A risk factor is something that increases the chance of developing a disease. These can be modifiable, such as lifestyle changes, smoking, things like that, diet. These are things that we can fix or we can alter or change. But then we have those risk factors that are non-modifiable, more specifically, like a family history of disease. But it does not mean the disease is guaranteed. Many people have risk factors and never develop prostate cancer. Risk factors help guide screening and conversation, not create fear nor blame. Think of risk factors as information, tools that help you and your healthcare provider make informed decisions together. When you know your risk factors, it helps to determine whether you need to be screened earlier or not. Or if you have several risk factors, then you know, okay, I have some things that's going on with me, things that are specific to my individual self. So let me start having these conversations with my healthcare provider to assist me in making informed decisions. Next slide. Age is the biggest risk factor. Age is the strongest risk factor for prostate cancer. It's uncommon before age 50, but the risk rises steadily after that. Most cases are diagnosed in men over age 65, which is why discussions about prostate health become more important as we get older. If you're over 50 or approaching it, this isn't meant to alarm you. No, not at all. It's to inform you. It means it's a good time to stay engaged with routine checkups and speaking to your healthcare provider about screening, whether it be certain lab work, more specifically like a PSA or prostate-specific antigen test, or maybe even further like a biopsy. These are all things that we have to consider, or our loved ones have to consider when we start looking at what are our biggest risk factors. Age is definitely the leading one. Okay, next slide. Okay, now this slide is really important and it deserves a respectful conversation. African American men are more likely to develop prostate cancer, be diagnosed younger, and have more severe disease. This is influenced by a mix of biology, access to care, and social factors. But what's important is knowing this risk so that screening conversations can start earlier. Awareness allows people to advocate for themselves and the people that they love. Next slide. Family history and genetics. We have to talk about that. Family history matters. Having a grandfather, father, or brother with prostate cancer increases risk. Some inherited genes, like the BRCA2, and I don't know if you've ever heard of the BRCA2, but which people mostly associate this particular gene to breast cancer. Okay, but this specific inherited gene can also increase prostate cancer risk. That said, most prostate cancers are not inherited. Still, it's helpful to talk with family members about cancer history, not just prostate, but breast, ovarian, and pancreatic cancers as well. Next slide. We also have to consider hormones and prostate growth. Male hormones like testosterone are normal and necessary. They help the prostate grow and function. Over many years, hormones may also support the growth of cancer cells. But remember, there is no single cause, and hormones are not a single cause. This is all about understanding long-term influences, not labeling hormones as bad, but balance and monitoring over time is the key. Next slide. Okay, lifestyle factors. Researchers continue to study lifestyle factors. Evidence suggests that diet, activity level, and maintaining a healthy weight may influence prostate cancer risk. Plant-forward eating or whole food diet, vegetarian diet, gentle movement, exercise, and limiting processed foods support overall health, even if they don't guarantee prevention. The focus here is not on perfection. It is on doing what's realistic and sustainable. Next slide. Now we want to talk a little bit about what does not cause prostate cancer. Okay, this is a myth-busting slide right here, and it's an important one. Sexual activity does not cause prostate cancer. Okay, vasectomy has not been shown to cause prostate cancer, and there is no single food that causes it. If you've heard other myths or rumors, this is a great time to talk about it. This is a great time to ask or talk about these misconceptions with your healthcare provider, because talking openly builds trust and clarity. And I'm sure you've all heard some, inconsistencies or either some myths about cancer. But having those questions or taking those, what you may feel like, what we may say, misconceptions to your healthcare provider and talking these things through can help you become more informed and encourage you making informed decisions regarding your health and regarding screening. Next slide. What can we do? All right. We've talked about all the things, but what can we do about them? There are things you can do. The main thing is know your risk, your age, family history, and background. Stay active in ways that feel safe and enjoyable. Choose balanced, plant-forward meals when possible. But most importantly, I encourage you, talk with your healthcare provider. These conversations work best as shared decision-making, and you're encouraged to bring a trusted family member with you to these visits if that helps. I always encourage my students, I encourage my patients, please bring your family member with you. That way, not only are you informed, but your family members are informed as well. Also, it also helps to have someone with additional questions. I know when I go to a doctor's visit with my husband, he may have some questions he might want to ask the physician, but I have a plethora of questions that I also want to include. And I can also provide a little bit more information if he decides not to share some things. So having that loved one there, it can ease the tension, provide a little support and comfort, and it can also have someone to also advocate on your behalf and ask those questions that sometimes you may feel, you may forget, or you may feel ashamed or not, you don't want to ask. Okay. Next slide. When to start the conversation. So many people begin prostate screening conversations between the ages of 45 and 50. And earlier for those at higher risk. Like I said, if you have higher risk when it comes to age, and more specifically, if you have a family history of prostate cancer, you might want to have those, questions a little, those conversations a little earlier. But there is no one-size-fits-all plan. The best plan is one that fits your values, your health history, and your comfort level. Good questions to ask include, I'll state it again, what are my risks? What are the pros and cons of screening for me? We want to make empowered decisions. We want to make informed decisions. We don't want to make decisions based out of fear. I know sometimes in our community, we hear people say, oh, I tell you what, I don't want to go get screened because I don't want to hear some bad news. But the thing about prostate cancer, like I said, it's slow. It occurs and grows, develops over time. And if it's caught early, 98% survival rate. So if we can get screened early, or if we can get our loved ones to get screened earlier, the higher the chances of what survival. And that is what we want. More time with the people that we love, living healthy and holy. Next slide. So some of the key takeaways, or I would like to say the main takeaway. Summarizing it up, there is no single cause of prostate cancer. Age, race, and family history plays the biggest roles. Healthy habits support overall wellness, and awareness opens the door to earlier, better conversations. The goal isn't fear, it's about empowerment. Next slide. So I like to pause here and just let you know I do invite questions. We are going to have a Q&A session, and I will be in the chat to answer any questions, like I say, in a timely manner and to the best of my ability. But if questions don't come right away for you, that's okay. Writing them down and bringing them to a healthcare visit is very helpful, along with your health history, things like the medications you take, your lifestyle, any lifestyle situations. All of that information is relative. And if you're in a higher risk group, consider asking about earlier screening options. Your questions do matter, and your healthcare provider want to hear them. Next slide. Like I said, like the wonderful MC said before, I do believe in evidence-based practice. All of my information, my questions are referenced if needed. And I just like to thank you all for having me speak to you all today. I hope I provided some foundational information. And like I said, I will be in the chat to answer any questions that you all may have. And we will be moving on to the next part of our program. Thank you very much for having me speak.
Thank you very much, Dr. Hudson. We appreciate that overall comprehensive information flow about the etiology or the cause of prostate cancer. And I'm sure the questions that come up, you will be able to answer them.
Absolutely.
We want to move on to our next segment, which includes talking to people who had the experience of having this disease diagnosed for them. Our first speaker is Alaric Gardine, a frat brother from Omicron. He was raised in the United States Virgin Islands and was living in the United States for a long time. He's currently working with the Jacksonville Fire and Rescue Department. He was diagnosed with prostate cancer back in June of 2024. He chose the surgical solution for the problem. And after deciding to have his prostate removed, Mr. Gardine has been cancer-free for 1.5 years now. Mr. Gardine, you have the floor.
Good evening, one and all. Thank you again for giving me the opportunity to share my experience of cancer survival. As Dr. Robinson said, I am now a cancer survivor. I have since September 2024 when I had the procedure done. I actually decided on having the prostate removed. My journey started though back in May of 2024 when I went for my annual physical. My doctor looked at my PSA numbers. They weren't high, but out of an abundance of concern, she referred me to a urologist. One thing that the urologist asked me was, had I ever done a digital exam? And I tell him no. I thought the PSA was good enough. I didn't bother with that. But he told me that even though your numbers might be okay, that doesn't mean that your prostate may not may or may not be enlarged, and that you should still do the digital. So, however, he said he was going to give me another test, and then when I come back, he was going to go ahead and do the digital. And I said reluctantly, okay, no problem. However, when he got the results, they were off the chain, and so he told me to just go ahead. We just went and did the biopsy, and of course, after that, I found out I had cancer. I was very surprised. Um, I wanted to know, why does this happen to me? What did I do? Um, and I went through the 5 stages of grief. One of which I would like to talk about is anger. I think it's very important. Anger and depression, I would say. I started acting very abnormal. I withdrew from my family, and you know, that I quickly realized was the wrong way to go. A lot of people, they take it out on their family. Uh, Very quickly, I realized this is who I need to rely on. And look, and my wife was very instrumental in bringing me back to center. Uh, as far as with acceptance, I knew within 2 days what my plan was, which was to just take it out. I just didn't want to uh, have that in me. So that was my plan. But that's pretty much, went ahead and we did it. It's been a long recovery, but I am cancer free, and I'm here to say, it is very important to always get that physical, that annual physical. Another thing that I wanted to bring up was I would trend what my PSA level was. And I noticed I was in the high 3.0, 3.3 point level. I understand 4 is where, they say get checked out. However, I feel that, even though your PSA may be below that number, just because it's not at that 4 point level, you should still, get it checked out and get further assessment of what's going on. Um, Again, I'd like to thank you guys for giving me the opportunity to speak, and I hope you were able to learn a little bit of my from prostate cancer from my experience.
Thank you, Brother Gardine. For those of you who have been listening, a term PSA that Brother Gardine mentioned, prostate-specific antigen, that's a protein that's secreted by the prostate gland. The basic number for being considered normal is 4.0. But again, we're talking about the African-American community where we have a more aggressive disease. And sometimes he mentioned he didn't hit the 4.0, but he still had cancer present. So that's important to know. The other important key term he mentioned is spousal involvement. So for all the ladies who are listening, you have an important role to play as far as your significant other. And that's by encouragement, that's by listening, and that's by being aware of what this disease is all about. So thank you, Brother Gardine, for bringing that up. Our next speaker is Brother Pedro Dash. Brother Dash is a financial advisor with 27 years of experience in financial services industry. He's a graduate from Embry-Riddle in 1993 with a Bachelor of Science in Airport Management. He currently manages over $30 million in client assets and specializes in helping individuals and small businesses take control of their financial future through financial education, budgeting, debt elimination, and insurance planning. He's especially proud of working with clients at all stages of their financial journey, and his philosophy is important. It's not what you make, but what you keep. And he strives to push that forward in his associations with his clients. He's been married for 28 years and a proud father of 3 children, including one who's an attorney, another who's a PhD fellow in mathematics, and the third who is a nursing student. So, Brother Dash, the floor is yours. Brother Dash? We can't hear you. I think we're having some technical difficulty.
Yes, what we can do is
Thank you, sir.
we can Mr. Dash, are you able to we can bring you back in if you want to log out and then log back in. We can continue on with the program
It's
and then bring you
really
back in.
Yeah, Mr. Dash, you can log out and then you can come back in and we can bring you back in on the program. Just we can go ahead and move forward and then we'll come back to Brother Dash when he comes back on.
Okay, as we all know, everything doesn't work as smooth as we want it to all the time. And if anything terrible can happen, it certainly will pick the right opportunity to show up. So we'll bring Brother Dash back. Right now, we're going to turn the program back over to Mr. Chad Workman.
Yes, sir. Thank you, Dr. Robinson. So a lot of what has been said tonight is very important and very inspirational. We want to thank our speakers for being here tonight. And then once Brother Dash comes back on, we'll also get his testimonial. But as of right now, what I would like to do is I would like to bring up.
Can you hear me now?
Yes, sir. We can hear you.
Yeah.
Go right ahead, sir.
Can you hear me now? Okay. All right.
Yes, sir.
What I think I'll do is just leave my camera off for the moment, see if that helps. Brother Robinson, I was speaking right, great introduction, and all of a sudden I froze. So I apologize. But what I wanted to do, can you still hear me?
Going in and out a little bit. So if
I
you said if
wanted
you turn
to
off your
talk a little bit about my journey.
okay.
I am now 56 years old. I was diagnosed at, let's see if that makes a difference. Okay.
Yes, that's a lot better. Yes, sir. Go right ahead.
Great. Okay. All right. Technical difficulty. Let me see if I can start again. My name again, Pedro Dash. I been diagnosed at 51 years old. I did not go to my doctor. I'm going to tell you that right up. I stopped going to my doctor about 3 years before because I was upset with him. You know, he was suggesting I get a sleep test, and I didn't want to do it. Finally, cajoled me to do it. Then I got a bill for the sleep test, which was over $1,000. So I got upset and stopped going to the doctor for about a 3-year period. Okay. Right in the early of 2021, I started having a little bit of back pain, but it was no big deal. You know, I was working through it. And right around June, it's just kind of funny how things happened. I was changing the carpets. I own rental property, so I was changing carpets myself for some reason. And at the end of it, I had severe back pain to the point that I could barely walk. And didn't go to the doctor. I went to a chiropractor. I finally went to urgent care, and my wife insisted I go back to the doctor. And at that point, one of the first things he did was he asked, when was the last time you had a PSA test? I hadn't. I have not had one. So he did one, went through all the regular services, did a PSA test. I went home. Before I got home, he called me. Mr. Gardine, and I think Dr. Robson said that your PSA is usually 4 or below, but my PSA was over 1,000. And for people here, that is not a good thing. And called me, went back, and I went to see a urologist right away. And urologist said, you more likely have cancer, the PSA so high, and wanted to do a biopsy. And he said, your situation is very serious, and scheduled me to do a biopsy. I think it was 3 weeks out. And I said, well, if it's serious, we got to do it sooner. And the reason it was scheduled for 3 weeks out is because they had to see what kind of insurance I had and who would cover it. That was not good enough for me. So I said, I'll pay cash, and bring it back my profession in it. That's why the importance is of saving money. I decided I would pay for all my services cash until we could figure the insurance out. I had a biopsy within 2 days. I had a biopsy done. And the next thing you're probably going to hear about is Gleason scores. I had a Gleason score of 27, which again is not very good. One of the important things for me is I had a lot of questions. I was very scared. I did not know where to turn. I was fortunate. I have some physician clients, and gotten close to some of them. I called one of them. I was just scared. I need you to explain to me what's going on. Fortunately for me, his father had been a prostate cancer survivor. So he walked me through all the stuff that Dr. Hudson spoke about. So I was hearing things in a language that I can understand. Okay. And I understood where we were going, what the Gleason score meant, what we could do. Surgery was not an option for me after we did some scans because I had my cancer spread. So I went to one doctor, oncologist. I was not very happy with him. And I took a second opinion, which I had to pay for. The insurance wouldn't pay for it. So I paid for that myself, and I ended up with oncologists that I really liked. And after a series of questions, and we did genetic testing, and I ended up taking a medical, my treatment was pretty much based on medications. I never did a surgical testing. They were insistent I needed to, what was going on in my family. I started asking questions around, and I found out that prostate cancer did run in my family, but I never knew that. So I was, very upset, and I was blaming, man, if I had gone to the doctor 3-4 years earlier, if I knew there was, but all that made no difference. So I'm going to implore to you, gentlemen, is get your testing done sooner than later. Ask questions. We don't talk about these things in our families. Ask questions of what your family history is. I don't know how your family works, but we never talked about this. I have now talked to my son now, who is 26 years old, and I said, you will start getting tested at 35. So get tested early, know your options, and know your history. Thank you.
Thank you very much, Brother Dash. You mentioned some important points for everybody who's listening. Brother Gardine talked about the baseline, which was 4, and Brother Dash talked about the possibility of extending that baseline, which was 1,000. So you can see between 4 and 1,000, you can fit in and have a diagnosis that's positive. He also mentioned the Gleason score, which is just the way the cells look underneath the microscope. And the higher your Gleason score, it ranges from 1 to 10. It may mean that the look of the cancer is more severe the higher the number is. So that biopsy gives you a chance to see what the cells look like. So all of the things that he mentioned, you'll probably hear in the subsequent sessions as we go on to talk about diagnosis of this disease. But thank you, Brother Dash. Thank you, Brother Gordine. And I'll turn it back over to you, Mr. Workman.
All right. Thank you, Dr. Robinson. Again, thank you, Pedro and Alaric for your testimonials, and thank you, Dr. Hudson, for being here as our medical speaker. I also want to take some time out again to thank the Omega Psi Phi Brotherhood for this opportunity, and then to also thank your leadership that has joined us for this evening. And if you could, in the chat, if you could place your chapter names and your positions within your chapter, that would be awesome to see that representation and that leadership come through. All of you brothers are leaders in your communities. Omega Psi Phi is a very strong presence in the Divine Nine, and your influence on the community. That's why we partner with you, because y'all have the community and we have the resources, but y'all are bringing the resources to the community just from what you do overall. So thank you again to the Brotherhood. So now, since we have had our presentation by Dr. Hudson, now we're going to do our quote unquote final exam for what was presented this evening. So if I could have we'll bring up the post survey link. And this post survey link is similar to what you took at the beginning at the pre-survey, but this post survey is going to really gauge that gain of knowledge. And this also gives us, Mayo Clinic, a great opportunity for feedback and to see and evaluate how we can continue to improve these types of conversations. And like Dr. Robinson said, you will hear other details and other parts of the next 3 sessions. So we will get more into the scientific terms that you heard earlier, but we will definitely grow your knowledge. So just take a couple of moments to take that post survey, and we'll move on just a couple of minutes. So I'll give you a couple of minutes to complete that. All right, just give one more minute. All right. Thank you all for taking the time to do that. And these sessions are recorded also. So please, when this series is over, please share this out with your communities. So what I want to do now is I would like to do some calls to action. And these calls to action are ways of informing you all about what we do here at Mayo Clinic as part of the community outreach and engagement team, and also what the Brotherhood of Omega Psi Phi, what they have been doing with us through our collaboration with them all these years. And so first, I would like to bring your attention to these two QR codes on the screen. First, I want to, the one on the left there, Community Engagement Studios, or CE Studios, as we call them. These are ways in which communities can speak and hear from the researchers themselves who are designing these studies and implementing them and trying to get approval for them. And the community gives that researcher feedback. That researcher may have come to a brick wall as far as like what's the next step, or maybe it's a brand new study, an idea that they are trying to get out, and they come to the community, they come to us, COE, and we give them a cohort of individuals to give them feedback on how to better design their studies, or give them ideas about how that study is going to impact the community once it goes out into the community. So this feedback is very important and very valuable, because we have had researchers that have used this, the resource of hearing back from the community, and been awarded, grants. So the community is the driving force on how a lot of these studies really get approved and get going. So that QR code leads you to that. It's a great way to get involved. And then to the right there is the Community Research Registry. This is another opportunity in which you can learn about research trials, both clinical and community-based trials. Not all research is laboratory-based or medication-based or investigative device or drug. Some of them are just simple surveys that researchers and scientists are looking at on what the community needs are. And your participation in this registry is a good way to learn of what's going on. It does not enroll you in the research per se. It does not enroll you into a research study, but what it tells the investigators at Mayo Clinic is that you're interested. And what you do is you set up a profile, simple demographics, what you're interested in, what types of studies you're interested in, and then the researchers match you to a study that you may qualify for. That coordinator contacts you and asks you if you would like to learn more about that study, yes or no. And then if yes, then you go on to the next step. And it's a great way to get other people in your circle involved with research and let them know that research is not, or does not have to be a scary experience. It's a learning experience, and it's very important, especially in our Black community, of participation in having this resource available for us. And then also on our next slide we have some ways that you can follow us either via social media or keep us in your loop, in your circle, in your feeds, in your updates. We're regularly out in the community, so we're always posted on social media. Follow us and send these links to your cohorts and to your family, and follow us in the community. Give us feedback. Give us kudos when we're in the community, and it's also ways that you can volunteer with us as well. So next, I would like to bring to the podium per se. I would like to introduce one of our study coordinators. This is a study I would like her to highlight. So, Ms. Sandra Casanova-Leyva, you have the floor.
Thank you, Shad, and thank you to the community outreach and engagement team for putting this together, and for everybody that decided to take the time today to learn about these. My name is Sandra Casanova-Leyva, and I am a senior program coordinator here at the Mayo Clinic in our research shield. And I am here today to share with you an opportunity to participate in research. Before I get started on sharing with you what a research study is, I would like to make sure that I mention that research is extremely important for all of the areas of the clinical and medicine. It is the way that our doctors get the understanding of how to treat diseases, learn more about diseases, and target that cure better for their patients. So with that, I would like to share this opportunity, which is a research study that our cancer center has for prostate cancer patients that have low vitamin D. This study is looking to understand the role of vitamin D in the immune response for African American patients that have a personal history of prostate cancer. The reason for this is that the literature has shown a positive correlation between optimal levels of vitamin D and a better outcome for prostate cancer patients. Involvement in the study is an 8-week period of taking vitamin D if your vitamin D is found to be low, and some blood work as well at the beginning and at the end of the study. All of the procedures for the study are covered by the study, and the study is a nationwide opportunity, so you do not have to be near any of our campuses here at Mayo Clinic to participate. You can participate from wherever you are. So if you are interested and think you meet criteria and or know somebody that may be a good candidate for the study, I'll invite you to scan the QR code that you have on the screen, or click on the link that I'm going to post here in the chat and take the survey, learn more about it. It gives you some information about the details on the study, and complete the screening survey, see if you qualify and participate. Again, would like to conclude by saying how important it is for people from all backgrounds to take part in research, as these helps make medicine safer, better, and fair for everyone.
All right, thank you, Sandra, for introducing that, and I'll hand it back over to Dr. Robinson.
Thank you, Chad. I think there was a slide of a community event that was coming up. I think that's the only one that I have. Yeah. 2026 Men's Health Fair, scheduled for June 13th. So if you could click on that QR code, you can get all the information about that. want to make sure that everyone knows that this is just the first in a series of webinars. So next week, same time, same station, we'll continue the program and talk about detection and diagnosis. Following that will be treatment. And then there's a final one that involves survivorship and prevention. So there's a QR code, same one that you used to register for this first program. It's the same QR code that you can use for the others. And you need to register for each of the webinars in order to be allowed to sign in and sign on. I don't see the contact point for the fraternity, but for those of you who may be interested or you have questions for us as a fraternity, you can contact us at our website, which is www.daytonaqs.com, or Instagram at Omicron Qs 1948, or Facebook, www.facebook.com/Omicron Qs 1948. We'll be happy to engage with you or give you information about the up and coming programs. So I'd like to take this time to thank everyone for their participation tonight. It was indeed an honor to have been asked to kick off the first webinar. We hope that we provided information that is useful. If nothing else, we want to stimulate you to be advocates for your healthcare. Do not be afraid to ask questions. Do not be afraid to take a significant other with you when you go see your doctor. Do not be afraid to change your doctor if you're not happy with the service that you're receiving. You're not getting the answers to the questions that you ask. But we need to be more active in our healthcare and know that it's our right to get it done, and to get it done in a way that's going to be beneficial and understanding for us. So thank you very kindly for being with us tonight. Omicron is proud, and we're happy to have had you. So Chad, I'll turn it back over to you.
All right. Yeah, thank you, Dr. Robinson. And I would like to welcome Dr. Hudson back in to answer a few questions.
Yes.
Thank you so much. The chat was popping, okay, and so and I was actually sending. Someone has gotten all the answers to the question. I sent it to one person, so forgive me, everyone. But I just want to real quick before we get off, I want to answer some of these questions verbally so you all can actually hear, and then everybody can get the information. It's one of the questions that I see here is, does a high PSA number translate into cancer and a need for emergency treatment? Just like the brother said before, when you get that PSA screening or you get that lab work done, and depending on the numbers, and we talked about from 4 to 1,000, depending on that number or the value, is going to determine what's the next steps. The PSA is just the conservative initial testing. Then after that, if you have numbers that are high, that will go on to say, okay, maybe we need to do a biopsy. What are our next steps? What other types of lab values do we need to evaluate? Like more genetic testing, looking for biomarkers, those type things. So yes, that PSA level is going to really direct the course of treatment. All right. Another question was, please explain what a Gleason score is. A Gleason score actually is a grading system. It's used like after a biopsy to kind of describe. Hello? Can you hear me? Hello? Can everybody hear me?
Yes, ma'am. Go right
Oh,
ahead.
okay. I didn't know what that was. All right. So a Gleason score is kind of like a grading system. It is used after a biopsy to describe how aggressive the prostate cancer cells look under a microscope. So this tells the doctor like how fast the cancer might grow. It can say how likely it is to spread. All of this type of information is gleaned from that Gleason score. So that is definitely something that that you might want to consider after having a biopsy. Let me see. Question: how do a doctor decide between active surveillance and immediate treatment? Again, I'll go on to say, what are your risk factors? What are your lifestyle? Like I said, if you have prostate cancer in your family, if you even have breast cancer, pancreatic cancer, those things are going to affect next steps, right? So maybe that is going to look at, okay, you have high risk factors, so we're going to watch it. And then immediate treatment, lifestyle factors combined with a high PSA, we're going to start doing other things. We're going to start doing a biopsy. We may look at medications, things like that. So having a good urologist is important, right? Having a good PCP is important because a lot of us have HMOs, which means we can't go to a specialist until we see our PCP. If you have an HMO, that's different, but that's a whole nother talk show. Okay, let me see if I can find another question. I had some direct questions that I think we could all benefit from. Let's see. Questions that you can ask your PCP to stay on top of your prostate health. You want to ask questions like, based on my age and health history, what is my personal risk for prostate cancer? How often should I repeat my PSA based off my factors? Okay. You can also ask the question like, can you help me develop a long-term plan for my prostate health? Those are the type of questions that you want to go in. And I love when my patients write down their questions and they come in armed and ready. Because sometimes we get white coat syndrome. We get in front of a doctor or a provider and we go blank. Our blood pressure rises, we forget everything. So I always encourage you, while you're at home, while you're sitting down with your family or in a quiet space and thinking, that's when you need to write those questions down because you're calm and your thoughts can flow, and you take you take those questions into your provider, and you all can have a informed conversation. Thank you. I just wanted to answer those few questions.
Thank you again, Dr. Hudson.
Yes.
We appreciate your time and your information. Chad?
Yes, sir. All right, so this will conclude our first session for this evening. I echo Dr. Robinson with the thank you. And I would like to hand over to my team. Anything else before we close out? I see Mr. Howard, you have your hand raised. Let's see. Go ahead, Mr. Howard, you have your hand raised. Mr. Howard had a question for Dr. Robinson. We can get that question to Dr. Robinson. Would you consider opening this webinar to the entire FSO? I would like to reach out to our health and executive chair. So Dr. Robinson.
Yeah, if we can. Chelsea had mentioned that there was a capacity limit, and the entire FSO is the entire statewide fraternal organization. And I don't know if we would bust that limit, because it's certainly more than 1,000 people to have to get on the line. So it might not be, but Chelsea was saying it was going to be on YouTube, the recordings too. So maybe we can reach the entire state via giving them a link that they can go to for each and every one of the webinars, because it will be repeated on YouTube and they can look at their leisure.
Yes, sir, that's correct.
Oh,
I put
Brother
in the chat.
Robinson, also Brother Robinson, because
mhm.
we're recording this, we can actually, and talking to Brother Howard, because we're recording this, we can actually give the recording to the FSO.
That's
They
true.
can post it as well. So
Right.
we not necessarily the live link itself, which we can do, but we definitely can give the recording to the FSO and let them post it on the website. And I can get with you,
Okay.
Chad and Chelsea, with that. For that.
Okay.
Sounds great.
Absolutely. Can you all hear me okay? I know I've been having some audio issues.
Yeah, we can
We
hear
can
you
hear
just
you.
fine. Yes.
Okay. Okay. Yes. And that I just put the link in the chat for the remaining sessions next week, the 28th. And we're going to skip June 4th, but then June 11th and then June 18th. Those will continue on with the prostate cancer care continuum. And so those will be featuring other chapters and other special guests as well. But share this information as much as you can with others. And even though each individual session only holds 1,000, as Dr. Robinson mentioned, each of them they are being recorded, and then we will transfer those onto YouTube. And then everyone who is registered, we will email that out to you. And so, Mr. Campbell and then Dr. Robinson, we can work together to logistically get that to additional leadership. That's
I
no
know if
problem
it
at
can be
all.
done, you're going to be able to do it. So we have no worries about that.
Well,
Thank
we,
you.
we, we appreciate you all. Absolutely. Thank you so much, Chad and Dr. Robinson, Dr. Hudson, to the gentlemen that shared their stories, Mr. Dash, Mr. Gardine. Thank you all so very much. And to Nicole and I, we were kind of running back tech. And you'll hear us and see us later on. But we really appreciate each and every one of you for staying on tonight. And then let's challenge our community. These are open. So let's challenge our community to share this information and invite them to attend the ones that are coming up. So thank you all so much. Chad, you can close us out when you're ready, good sir.
All right. With great minds and great hearts and great knowledge gained this evening, I bid you all a happy evening. Enjoy your dinner, enjoy time with your family, and be blessed. And we will see y'all on the next one.